depression as a cause of suicide. Like we all know that suicide has become a thing that has been so rampant in recent times. A whole lot of people have taken their own lives due to one reason or the other. And if we look at it, even though there are a whole lot of causes that could have prompted those people to take their lives or even attempt to take their life, depression is like the major cause of this suicide. So I'll take us through what depression is, what the symptoms of depression is, and ways to prevent it from actually causing us to make choices that would actually be irreversible, probably as individuals or people around us that need this knowledge. We can also be able to share it with them. So depression is actually a mental illness. It's a mental illness that has to do with mood disorders. It affects majorly the mood of the person. It makes the person to move away from the normal state or the normal mood that everybody knows the person to be. Like, depression is something that affects us as a result of our emotions. It affects us as a result of being overwhelmed by emotions, by actions and reactions around us. Although scientifically there are a lot of pathophysiology, psychopathology as to epinephrine and non-epinephrine rather, and serotonin, which are neurotransmitters that are affected, increase or decrease during the process of the period of depression. But I would not really go into all that because I don't want to waste our time with explaining how that works. So I'd just like us to focus majorly on the behavioral and emotional causes of depression and how we can actually stop it from making us take actions that would be permanent and would actually cause the life of us and people around us. So like I said earlier that depression is a mood disorder, that it's a mental health disorder that is majorly affected, that in which our mood is majorly affected. And some of the symptoms of depression is that a person that is depressed feels sad all the time. A person that is depressed loses interest in things that have always been of interest to him before. Probably a person that likes partying now tends to, when you as the friend that knows, okay, my friend likes partying and you're ready to go for a party and you call on your friend, okay, let's go. The person will tell you, I'm not interested in going to the party. I don't even want to talk to anybody. I don't want to see people. If people see me like this, they would feel like something is wrong with me, and I don't want people to know something is wrong with me. And the person just loses interest. Probably the person has a favorite food, and all of a sudden the person is not even interested in seeing the food, not talk of eating it. The person just loses interest in everything that had been pleasurable to him. Then there is also a lack of appetite. The person becomes withdrawn to himself, doesn't want to do anything, doesn't want to eat, feels like eating is not important anymore. He just wants to keep to himself and be on his own. Another signs and symptoms is the person has trouble sleeping. That is one of the major things that is a sign of depression. The person doesn't sleep or the person sleeps too much. It's either the person has insomnia or the person has hypersomnia. Then loss of energy, like somebody that is always playing, a fun to be with kind of person, and all of a sudden the person just loses the zeal to do all the fun things that he has been used to doing. The person doesn't want to communicate. The person feels that it's better for him to just sit on his own and not interact with other people. Those are the various symptoms of depression. Also, the person has difficulty in communicating. That is the first and most important symptom of depression. The person doesn't even want to talk out and have a discussion with anybody, no matter how not important the discussion seems to be. The person just doesn't want to be involved in talking to somebody. The person is thinking down on himself. The person feels worthless, feels lonely, feels useless, feels helpless. Those are the signs and symptoms of depression. Now, the funny thing about depression is that everybody's at risk of having depression. Like, I can be depressed tomorrow. Any other person can be depressed tomorrow. So it's not like there is a particular person or group of people that is at risk of having depression. Anybody can be depressed. So I would also like to take us through the possible risk factors, the possible causes of depression that we have. A whole lot of things causes depression. That the only thing about depression is that when the person is depressed, we tend not to really understand why this person is depressed. And being unable to understand why the person is depressed is the first pointer as to how we know that this person is depressed, because the person is not telling us. So there is no way we can actually solve the person's problem. So part of the risk factors of depression, it includes loneliness, marital issues, abuse, traumatic events during childhood, stressful life events, recent life events. Okay, look at the case of this COVID-19. A lot of people have lost loved ones. Some were not able to contact their loved ones in months because of this risk of transferring the virus from one person to the other. A lot of people are falling into depression because they feel that these life situations are stressful. Some people have lost their job as a result of the pandemic and the lockdown and all. A lot of people have lost loved ones due to accidents, and this has led them to fall into depression. But then they find it difficult to communicate, and that is why we do not even know, okay, this is why this person is being depressed, and we don't know how to help the person. So another risk factor of depression is that our personality. Some people have this kind of personality that they worry too much. They tend to take things seriously. Even things that on a normal day should not be taken seriously. For instance, you're going for an event and you're worried about this clothes I'm wearing. Will people like the way I'm dressed? Will people be impressed? Am I saying too much? Am I actually saying what I'm supposed to say? Rather than allow yourself to enjoy the atmosphere, enjoy the event and all that, but then you worry too much as to what other people think about you. Some people worry as to the effect of possible life situations. Probably you're writing an exam, you've prepared well, you're sure you have done your best in the exam, but then there's this jittery feeling of, am I going to pass? Am I doing well? Did I do well in the exam? All these things gradually lead people to fall into depression. Now, there are different depression ranges from mild to moderate to severe depression. But the funny thing is that there is no specific point at which the person cannot lead or decide to commit suicide. What I mean is the fact that the person is having a mild depression, that the symptoms are not so obvious, and the person still seems to be doing the normal things he has been doing, but then the person is still a little bit depressed. It doesn't mean the person cannot just decide to end it all. It doesn't mean the person cannot just think to say that to commit suicide is the next thing. And as well as somebody that is severely depressed and the person has gone into total mutism, the person is not even saying anything, the person is not reacting to being communicated to, doesn't react to pain, doesn't even feel the presence of other people with him in the same room. Suicide is a decision that anybody can make at any point or at any stage of depression. So that is why depression is a very, very tricky mental illness, because it's, in as much as we feel that there are stages of depression, the stages of depression is not defined. It's not certain that, okay, because this person is having mild depression, the person is not going to commit suicide and the rest of it. Another thing we do not really take cognizance of is children. A whole lot of children go into depression probably because of decisions that their parents have made during the course of their upbringing. And, this is even more common with parents in this part of the world, I mean Nigeria, where parents just feel that they can make decisions for children. They see the children like they really don't have a say in decisions that are made for them. They are still too young to make decisions. And eventually, probably the child is not even cool with the decision that was made for him. He's not happy about it. The child just goes into a form of depression that is not coming out to express himself that, okay, mommy, what you just decided for me now is not what I want. I want this, I want that. Thank God that people in the more advanced and developed countries actually allow their children to express themselves. But then the lack of expression among children in underdeveloped countries tends to lead into risks of these children falling into depression. And the funny thing is, their parents don't even notice that these children have gone into depression, and all of a sudden we just hear that a 7-year-old boy committed suicide, and you are thinking, what's the problem with the boy? Is it that they are not giving him food? What could be the problem? Whereas we don't know that there's actually some emotional displeasure that he has been undergoing, that he doesn't even know how to come out and tell you that, okay, this is what is wrong with me and the like. So I would also like to go further as to tell us some of the major symptoms. Okay, before I say that, let's quickly run through what suicide is as well. Then we can come back to now talking about how to actually prevent depression from leading to suicide. So suicide is an intentional attempt or suicide is an intentional attempt of causing harm to oneself, which may lead to death or near death. Suicide is a deliberate act. It's something that the person who has carried it out has thought about it and has reached a conclusion that this is what I actually want to get done. Now, there's a difference between a person mistakenly taking his own life, probably by playing with a knife, mistakenly cutting your wrist, and the person bleeds to death. That is not suicide. But suicide is that the person actually has the intention to get killed, to end it, to die. And the person is able to achieve it. There's what we call attempted suicide. That's the act of intentionally trying to harm oneself or causing one's life to be lost. But then the person is not able to achieve that. But we're not going into all that today. So that is suicide. Suicide is the act of intentionally taking one's life. So I would now like to link depression with suicide. Now, a person that feels worthless, a person that feels useless, that feels that his situation is hopeless and there is no way to come out of the stressful life situation that he presently is, the thought, the thinking faculty or the thinking ideology of a person changes from the normal. A normal person would see that, okay, this situation is something that I can come out of. Probably the person has a whole lot of debt that the person is in. The person feels like, okay, if I can plan well, I'll be able to clear my debt and I'll be fine, I'll be out of the particular situation. But then somebody that has gone from normal to abnormal, which is somebody that is depressed, would not have the strength, would not have the ability to actually think in a productive and a creative way. The person rather feels like, okay, I'm in this situation and the best thing to do is let me just end it. Once I die, the person that I'm owing will know that I'm dead and the person will not look for me to pay the money I'm owing again. Or probably once I die, my daddy will love me more and he will miss me and the rest like that, a whole lot of thoughts. But the person has made that decision. The person has been able to move from just thinking about it to thinking that the solution to the problem is actually ending his own life. Now, how do we try to prevent depression from leading to suicide? The only way to do that is actually to make sure that that depressed person comes out of the depression before the thought of suicide comes. Now, once there's an ideation of suicide, it becomes very, very difficult to remove that thought from the person. Because the funny thing is, somebody that is having a suicidal ideation will not come out to tell us that I want to kill myself until actually maybe the person has already gotten the pesticide that he wants to use to kill himself. He has already gotten the time he wants to kill himself. He already has a scenario set for him to kill himself. Then the person comes out to say, okay, I'm ready to kill myself, and the person now starts giving us pointers. Another funny thing is that a whole lot of people that commit suicide, they drop pointers, but because we feel that this person is trying to seek attention, this person is just being dramatic, we don't see these pointers. Like some weeks back, I saw someone just drop on his status and said, this stress is too much. What's even the gain of going through all this, and eventually how much do I get as a salary? And I just saw it and I overlooked it. Like I felt, okay, I'll come back to chat with him later. I'm busy, I'm at work and all that. And the next thing I heard, like 4 hours later, was that the guy was dead. And everybody was like, what happened? What happened? Then we started seeing people posting his last comment on WhatsApp, his last status on WhatsApp, that this was his last statement, this was his last post, and everybody started putting the dots together, and we realized that they had actually created an opening for us to actually prevent him from taking that action to kill himself. But we all overlooked it because we felt that he was just seeking attention. A whole lot of people drop comments like, what is this life worth living? A lot of people drop comments like, is this life worth living? What is the essence of being in life? What is the essence of being in life? Nobody cares about me. I'm going to kill myself. I wish I could just die. And we just think it's an attention-seeking strategy, and we don't actually go ahead to find out what the problem is and try to help the person solve it. Now, the major way at which we can actually prevent people from going into depression and eventually committing suicide is by communicating with them. We ourselves, because I already stated earlier that we are all at risk of falling into depression and eventually committing suicide. The first and major way to prevent all this is to be able to communicate. Fine, I'm not saying that we should post our life problems or share our problems with just anybody, but then we always have to have one person, at least one person, that we know that, we can trust, we can talk to, and the person will actually listen to us and not judge us, even if it is just for the person to listen. Because obviously, there's this saying that goes that a problem shared is half solved. I would want to say that a problem shared is solved, because even while you are trying to share the problem, you tend to see it from a different perspective, and you can even think of solutions that you can possibly use in solving the problem. Talking about it gives you room to think about it. When you are talking, you think through what you are saying, and you can even solve the problem on your own without getting an input from the other person you are telling. Communication is key in everything we do. We have to be able to talk out, because the funny thing about mental illness, mental disorders is that it has to do with the mind. We can see what is inside us. The good thing about fever is that a thermometer can tell you your temperature, and everybody knows that, oh, you have fever. The good thing about high blood pressure is that there is a instrument that is used to measure it, the sphygmomanometer, and everybody knows, oh, your blood pressure is high. This is the way to go about it to bring it down. But when it comes to mental illness, only when the person starts to exhibit abnormal behavior, that's the only point in time when the people around start to see that, oh, there's something wrong with this person. And then the people tend to try to help the person to look for a solution. But then, most times in case of depression, by the time the person starts exhibiting these major symptoms, the person has really moved from mild to probably moderate or severe depression. Some don't even move at all. They just jump the border and go straight for suicide, and voila, the person is dead, and there's nothing we can do about it. Another major factor that restricts people from seeking treatment and from speaking out when they are depressed or when they have suicidal ideation is the stigma. A whole lot of people, once they see, okay, there's this funny scenario. When I was doing my psychiatric training, I was in a bus. I didn't know my way to the school where I wanted to go and do my registration, and I just knew that I had to take a bus to Yaba, and from Yaba I had to locate the hospital, but I didn't know the exact bus stop I was to come down. So when I entered the bus, there are times when you enter a public transport and you and the people you meet in the bus, you just have this connection kind of, and you get talking, and everybody was flowing. It was interesting. And then I heard the driver mention a particular bus stop, and the people that wanted to alight there said it was fine, they wanted to come down and all. So I felt, okay, I think it's time for me to ask where I would come down, so that I would not be taken beyond where I was going. And then I said, please, I'm going to Federal Neuropsychiatry Hospital. And in fact, the atmosphere in the bus changed. Nobody thought that maybe I could be walking there, or probably I want to see someone there. The thing is, everybody just assumed I was mentally ill, and everybody stopped talking to me. I felt bad. Now imagine that was me that did not even have any mental illness, or probably have not been admitted, or have not even been diagnosed of a condition. Now imagine somebody that has been diagnosed. Imagine somebody that knows that he's going there to receive treatment. Imagine the person was in my situation. The person could even decide to just alight from the bus and go back home. That this stigmatization is too much. Why is everybody treating me like not a human being? And the funny thing about mental illness is that just the way hypertension, diabetes is treatable and takes a very long time to be totally cured, that's the same way mental illness is. But people tend to see mental illness as the end of life for people, and that is the major reason why people don't even seek for help, because they feel like, once I come out and tell you, oh, I have mental illness and I have depression and I need somebody to always talk to. The doctor advised me to do this. The doctor advised me to do that. My psychologist said this. People they just close up from you, and you feel like that's actually another cause of some people's depression. A lot of people don't even have depression before, but because of the attitude their neighbors, people around the community put across to them, they move from a particular mental illness and go straight to depression, and from there they even end their life. So it is important for us to, at every point in time, understand that mental illness, depression is just a disease it's just a disorder rather, like every other diseases that we come across that is treatable. So that is another thing that would help us to actually prevent people from actually moving from depression to suicide, or rather moving from being depressed to being their normal self again. Then, as individuals, another thing we need to know is that the fact that you walk into a psychiatric hospital, a mental health clinic, a mental health facility to see a doctor doesn't mean you are mad. Like people will say, like everybody knows that everybody has a period in time that will display madness. It is the truth. At some point, you are just excessively happy and you are euphoric and you jump from here to there. It's a little period of displaying madness. Sometimes you just feel so down that you don't want to talk to anybody. That's a period of being depressed. And we need to understand that, and we need to seek help when we feel we need help. It may just be to go and see a psychologist, have a talk therapy with the person, and you are fine. But let's always have it at the back of our mind that we don't need to be ashamed to go and seek care. That alone reduces the risk of us now taking our problems from the mild level it is to the point at which we start thinking of